Hey everyone, Margarita here. This is part 14 of my severe carbon monoxide poisoning, which initially went untreated. I'm here to talk about some more of these symptoms you may be experiencing or Googling if you think you might have carbon monoxide poisoning or being regularly exposed, or you're looking on someone else's behalf that you care about. I'm going to get back into some of these symptoms here. I did have a dire need for oxygen, and that still does happen today. So initially, it was very extreme. And I didn't even have the words for it or couldn't even explain it because my brain was so burnt. And that burning feeling in the brain is the extreme lack of oxygen. So I lived that way for several years. It was well over 3 years that I lived with my brain burning to that degree. But that also went along with the dire need for oxygen feeling, where I would be ripping windows open, having to go into the fresh air or having to get to the freshest air possible. Because I was not receiving treatment initially as well. So that is part of that problem. And that's because you are so overloaded with carbon monoxide, you are being deprived of oxygen to an extreme degree, and not just like your lungs. It's your brain first, then your heart, then your lungs, then the rest of your body. So that was happening to me even before it broke through my brain tissue. That was happening from the very beginning. So I just did not have the words for it, but that's what that was. And I did spend quite a few years with my heat on and my windows open, or if it was summertime, I had to keep the air on and the air cold and crisp within the home, because there is more oxygen in cold, crispy air than there is in warm air or hot air or humid air. There's less oxygen. So then you would lose oxygen to the brain if you're being forced to be stuck in that state and you're not breathing the crispiest, coldest air possible. Or if you're just stuck inside without the circulation of outside air, not getting any fresh air, that's going to make your symptoms worse. So unless you're getting pure oxygen at some point, or hyperbaric oxygen, then that will make a difference as well. I do have a significant air quality issue. So does my son. That is still ongoing today. It was very extreme, and it kind of goes hand in hand with the muces, or the multiple chemical sensitivity that I was talking about in the last episode. It goes right along with that. We cannot have particles of any kind, any gases, chemicals, toxins, food toxins. We can't eat or drink the same things as everyone else. We can't breathe the same air as everyone else. There's numerous problems. But our air quality issue has gotten better since treatment. It's no longer as extreme as it once was. And in comparison, let's just say somebody with muces and multiple chemical sensitivity, the air quality issue, in the beginning, I guess you could say you're 1,000 times more hypersensitive, whereas where we are, once we've spent all this money in treatment, all these years have gone by, gotten us to where we are today, I would say we're about 100 times more sensitive than the regular person versus the 1,000 that we once were. So that's just to kind of give you an idea of the ratio of like what was going on, what is still going on. Now, we do need treatment going forward as well. So I don't think it's impossible for that condition and those problems to clear a little further. But right now treatment is on a pause. So, as I'm doing the videos, and let's say I resume treatment at some point during this, I'll be able to elaborate more on what I've experienced once I get to that point. Because I do want to document quite a bit of this now that I'm to the stage that I am. I want to keep documenting, and I wish I could have done it all along. I was just so sick and injured, it was not possible. So I will keep everyone updated on everything that is still going on and what goes on from here and what's needed going forward and how that all turns out. Transient loss of consciousness. You can fully lose consciousness. You can become in a coma. You can just be in and out of consciousness for days, weeks, months. I think I was for over a year at home by myself with the baby, in and out of consciousness. And that did happen at some point at the worst part of the injury. And that can still happen. I did lose all oxygen to the brain in summer of 23 from the wildfire particles coming over to Michigan from Canada. And I took in enough of the particles because my brain tissue is still open. Those particles went right through, cut off all oxygen to the brain while I was standing in Walmart. And I had an episode that you could tell the oxygen was cut off from my brain. And I had all these strange body movements before hitting the floor. And once I hit the floor, my head cracked open and was bleeding. And I was completely unresponsive, dead for 15 minutes on the ground, staring at the ceiling, bleeding from the head. I did come back on my own without medical intervention, and there was an entire aisleway full of people who saw the whole thing, along with my son, who was, I think, 7 at the time. By the time I came to on my own. By the time I came to, numerous people had gotten there. My older kids had gotten there, my ex had gotten there, the EMS had gotten there, and I was extremely confused. Although I did kind of know something was happening, I did not quite understand it in that moment, and I did know I was fragile and should not be traveling out and about with these wildfire particles. So it wasn't, because I had gone through so much in such an extreme manner, especially in the beginning of this injury, I didn't find it so alarming because I'd been stuck this way for so long and it was much worse prior. So I didn't think that it was going to happen like that, or it was going to become that extreme, but that did happen. So if you have one little breath or several breaths or a certain amount of time of a re-exposure of some type of particle and you're in that state, it can finish cutting off the oxygen to your brain. Since you're already overloaded with carbon monoxide, it won't take much. And it will cause you to become unconscious. And hopefully you are sitting somewhere soft or sitting down when that happens and not standing the way I was or driving. Let's hope that that does not happen to anybody. Now, I did have the delayed kind of carbon monoxide poisoning. It's called delayed neurologic sequela. That also made it harder to figure out what was going on in the beginning because I had left the area that was filled with the carbon monoxide on a Sunday. The last time I was in there, I'd worked that Friday, that Saturday, that Sunday. I was gone for several days. So I woke up overloaded with carbon monoxide on a Thursday. So 4 days after leaving, this made it a lot more confusing and harder to figure out because I did not know there was such thing as delayed neurologic sequela. So what that is the delayed symptoms of carbon monoxide poisoning and the delayed neurologic symptoms, especially because the very first symptom is I woke up with my brain pressed against my skull, along with many other symptoms, but that is the most noticeable and it's burning. So that is the delayed kind. It is not always delayed. Carbon monoxide poisoning is not always delayed, but it can be. And this can happen a day later, 2 days later, a week later, 2 weeks later, a month, and I believe even up to 2 months if you've had a very large exposure all at once and maybe we're just removed from it. I do believe that can happen. I have personally ran into about 30 or 40 people that have been poisoned by carbon monoxide as well during all of this, and I've exchanged information with all of them. And some of those people did have a delayed reaction as well. So that's where I'm getting my information on this, along with what I've read. And it usually is not 1 or 2 months later. I'd say a month tops, but I do believe it can happen up to 2 months. Most people have the delayed reaction within a week, I'd say. Now, you will always have a carbon monoxide sensitivity for the rest of your life, a hypersensitivity. You will never be able to tolerate carbon monoxide, any amount of it. I'm sure you can go in places here or there and not be so greatly affected with small amounts. However, you will always have a sensitivity to it pretty much for the rest of your life to some degree, some more extreme than others, depending on how severe your case was. Now, I did talk about how it appears to look like a mental disorder to other people when you're trying to explain or trying to seek help, what's going on. It is not technically a mental disorder. It is a physical disorder. It is a physical injury. It's just you're injured and your brain is not working properly, so it's hard to explain. Now, if you've already had a mental health history or been diagnosed with a mental disorder prior to becoming poisoned by carbon monoxide poisoning, it may make those disorders and those conditions much worse. So that could be a big red flag as well, if that's something you were already experiencing and then suddenly something goes way wrong or much worse. That is another big red flag. And even if you don't have a mental disorder, it still looks like you do. You will be screaming at times, trying to get your point across, especially if you're not receiving treatment. And what it is your brain is so fragile and you can't, all your senses are hypersensitive. You can't have sound, you can't have light. All these problems are happening. What it is, and you can't get away from it, and you're suffering in extreme pain and suffering along with all these symptoms with no relief ever. There's none ever, not 1 minute, not 1 second. So I was calling them mental toxic meltdowns. And what it is like extreme carbon monoxide poisoning without the inability to have any relief from the symptoms or it to ever go away for that significant period of time. So that's what I was calling that. It's not actually a mental disorder. But I can say that if you have, any other issues, I'm not just saying mental issues, if you've had any other issues within your body or any diseases or other problems you've had prior, those problems all become exacerbated by the carbon monoxide. So expect any old injuries, any problems you previously had, they will become worse, which it goes for anything, I guess, within the system. You will have this terrible this terrible internal feeling, like a sense of dread, like something's wrong, but you can't quite put your finger on it. That's carbon monoxide. You just keep getting this feeling, especially if it tends to only be in one place, which tends to be the place that's causing all of this. If you keep getting that feeling in that same building that you're in that's causing this, or in the same car or whatever, wherever you go that you think you're being exposed, if you're having that feeling, that's carbon monoxide. But it's like something's terribly wrong. You don't know what it is. You haven't overloaded with it. There's nothing screaming big red flags, but you can't put your finger on it. That's carbon monoxide. Now, for the longest time, I could not regulate my body temperature for the life of me. And it's still somewhat of a problem today, not nowhere near as bad as it once was. And I do know people with brain injuries without the carbon monoxide poisoning, they have that as well. So I have 5 brain injuries as of today and overloaded with carbon monoxide. It took about 3 years before my body temperature began to start to regulate again. And even then, like I said, I've been significantly re-injured numerous times. So that has played a role in the decline of where I was with it at one point. Plus, I have additional brain injuries now. So it is kind of an ongoing problem. It's nowhere near what it once was. And it does become a little exacerbated with each little tiny re-exposure as well. So that is a very uncomfortable, very hard to deal with problem. You'll wake up drenched in sweat, have to change your clothes once, twice, 3 times in the middle of the night. You'll just wake up drenched so much that it's out of control. Or even if that is the best way to get it out, sweating it out. If you do have the ability to work out and this has happened to you, I would recommend, if you can tolerate it, go ahead and keep doing it, because all the sweating that you do will remove more of it at a quicker rate. And if you take the activated charcoal capsules at the same time while doing this, that will absorb some of it as well to help rid it from your system. So I know that some people are not in the position to do that, depending on the degree of your poisoning. But if you can, it will help get it out quicker. And it's not fun, not being able to regulate your body temperature, extreme hot flashes and cold sweats and night sweats. It's all just the toxins trying to come out, along with the brain injury. So it's kind of coming from both sides of that, because I've joined several Facebook groups with brain injury and carbon monoxide poisoning. It is an issue in both departments separately. So when you have them together, it's a little more multiplied. Now, I don't know if you've noticed, but my speech delivery has changed throughout the course of me talking. You can have rapid speech delivery, rapid thoughts, and that is the carbon monoxide and lack of oxygen to the brain. And I do still have a problem with rapid speech, and it depends on re-exposures. It depends on how often I've been treating, or how many exposures I've had. There's several factors involved, but it is oxygen related and oxygen to the brain related in how much your brain is getting. So that is still a current problem, but it was way worse at one point, and other people don't understand that, and the brain injuries make it worse as well. That's just from the carbon monoxide. So it is coming from both angles on those 2 notes as well. And that's another problem I'm still having with the people around me, which is why I have mostly closed myself off from just about everybody, because other people do not understand what I'm forced to deal with. Trying to go about daily life when the people around you are acting like nothing ever even happened to you. It's really hard to do. So that is another issue. You will have periods of time where you'll lose chunks of time. And I'm not even saying that you blacked out. I think most of the time this happened, I'm pretty sure the people I've talked to as well, I think that they're fully conscious, and it has something to do with the carbon monoxide in the brain and or the brain injuries if there is one. But you will lose chunks of time, and there's nothing you can do about it, and your sense of time is off altogether. And again, that could be just brain injury alone too. Short-term memory loss, that seems to be a big problem. Not really so much long-term, but the short-term memory loss is an issue. I did have a facial recognition problem for quite some time. It's not, I don't really have that problem anymore, I guess you could say, but I did for several years. I did have, if you have to have procedures done and you're this overloaded with carbon monoxide, with brain injuries especially, there's going to be a problem trying to get any other procedure done, like a dental procedure or like a medical procedure. Let's say you had to have like surgery or something or get a cavity filled. There's some issues with that. So I'll get back more into that, but that can be a problem treating. I'm going to end it right there, and I'll be back with another one. Thanks.